Good morning. Dr. Tyler Hamel, Kingwood Chiropractor and Nutritionist, today talking about a straight spine and degenerative disc disease or bulging disc. So oftentimes patients come in, especially with low back pain and neck pain, and they'll say, "Hey, Doc Hamel, I went and got an x-ray and they said my spinal curve had straightened out, or my neck is straighter than it should be, or my low back is straighter than it should be." So that's number one. Or number two, they'll say, "Doc Hamel, I went and got an MRI and it showed some kind of degeneration or bulging disc in my neck or my low back." Sometimes they don't remember the level, but they'll say that. "My doc told me I have degeneration and arthritis maybe in the spine." All right, so let's address those two things. So straight spine. First, let's look at this picture here. You can see neck, mid-back, and low back. So the neck and the low back, it is supposed to be in a bit of a C curve, right? So your neck comes back a little bit this way, your low back as well. So it's called like a lordosis in a way. It's going to go this way. Your mid-back goes the other way. So in an ideal world, if those curves stay in place, that is the least amount of pressure by far on your neck, on your mid-back, on your low back. So it's important to understand that. But so why do we have problems? Well, again, when we look at forward posture or postural stress from sitting at a computer for 2 to 10 hours a day, that is the issue. So postural stress, eventually, it puts so much extra stress on, say, especially the neck and the low back, that we start to lose that curve. And what does that mean? So losing the curve means extra stress on the joints of the spine, on the muscles, sometimes the disc, and sometimes the nerve as well. So that could be anything from neck pain, cricks in the neck, especially headaches. And then we look at low back pain, sciatica, pain that goes into the butt, disc issues, herniated disc, all that kind of stuff can happen because of postural stress over time. Yes, there's cases where there's accidents, car accidents, people working out, doing dumb stuff in the gym, and they cause issues too. Facet syndrome, or extra pain or extra pressure in the disc, right? Neck or low back might cause disc herniations or disc bulges, no question. But most of those people that say had car accidents or gym accidents, they already have postural stress anyway. So their neck and their mid-back, or their low back, has probably already started to straighten out. So this is important to know, because what happens when the spine gets straight, again, way more pressure on the neck and the low back. So we have to address that and try to change that, do positive things postural-wise to change that. Otherwise, that can continue to get worse. And sometimes, even in the neck, we see a curve like this, and it starts to go forward. So it's now bending forward. And you know from previous videos that I've done, when our neck and head and face start to go forward, 1 inch, it increases the stress in there to 20 pounds, 2 inches, like 35 pounds, 4 inches forwards, like 60 pounds. And that's just too much for the spine to handle. So if you guys have been to the doctor or had an x-ray and it shows a straight spine, it's pretty serious, right? And you might say there's somewhat normal straightening of the spine. There really isn't, but a lot of us have postural stress, so you might have some straightening of the spine. But it's important to work on those curves, right? Like, in a nutshell, if I was to say it, like how to really fix neck and back pain, work on the curves or get the curves back. So there's things you can do, like putting a towel underneath your neck to promote the curve back in your neck. You can do postural exercises, strengthen the mid-back, strengthen the neck muscles to get that curve back. Low back, same kind of thing. We can do extension exercises. We can put a roll underneath our low back to help with the lordosis, or help us keep that curve. Just remember, if you don't keep the curve, there's a significant chance you're going to have more pressure in there and eventually pain. That's why a lot of us have gone through life. We've either had pain in the past, neck and back pain, or we have it now. And depending on how long that curve has been straight or starting to curve the other way, then we can have more serious problems. So it turns into joint problems, disc problems, nerves being pinched, right? So that happens just over time. So be aware of the curves. Again, if I could say just in general for people what to do to fix the curves, right? Get your get your lordosis curves back in the neck and in the low back. So how do we do that as far as chiropractic goes? Well, we can realign the spine to take pressure off of those areas. So remember, there's significantly more pressure in the neck and the low back when our spine straightens out. So we can adjust those areas to try to release the pressure. Y'all know if you've been to a chiropractor, you hear the pops or the cracks. It's just all it is pressure being released in the area, which is a good thing. If you have a professional do it, don't do it at home. But I would, I would say if you haven't done it before, and probably, maybe 30, 40% sometimes of the new patients who come in have never been to the chiropractor. They're a little leery of having the neck popped or the back popped, but it's a simple thing. All it is just pressure being released in the area. So that's number one. Number two, we can do corrective exercises. So like I said, we want to work on the curves, and there's multiple different ways to work on the curves. There's exercises, there's strengthening, postural corrective exercises. There's rolls that you can use to promote the curve, and that's pretty simple stuff, right? Lastly, trying to get inflammation and pain down. So people can do that, via medicine, or we have natural things to help with that, right? When you're losing the curve or the spine straight, way more pressure causes way more pain, way more inflammation. So that can be kind of a vicious cycle over time. You hear people say, oh, my neck's always hurting, my low back's always hurting, or I've just gotten used to that neck pain or back pain. That's because of all the inflammation in there. So that's what I would recommend. So if you have got an x-ray or an MRI and the x-ray showed straightening of the spine, or the MRI showed bulging disc, then that is the start of something that could be a lot worse. But keep in mind, bulging discs, that doesn't mean you have to do surgery. There's lots of things you can do naturally and work on your spine, work on your posture to deal with bulging discs. And a lot of people are living with bulging discs, and some of them don't even have any symptoms or any pain. So that's what I would recommend. Thanks, Eliza, for recommending me. I appreciate that shout out online here. And if you guys have any questions during this Facebook Live or even after, just put it in the chat box. Anything about back pain or neck pain, I try to come on here and do videos to educate the public on just simple general things, right? And it's like probably half the people who come in say, Doc Hamel, I had an x-ray that showed a straight spine. Like, what does that mean? Or I had an MRI that showed a bulging disc. And sometimes they're kind of scared, because their doctor doesn't explain what that is. But it's simple. It's simple. And there's easy things that you can do to work on, the spine, or trying to work on the curves. And it doesn't have to be a surgical thing. It doesn't have to be a pain management or pain medicine thing. So let me know if you guys are struggling with that. Put it in the chat box below. You can message me. You can call our office, 281-360-8387. Our website, www.wellness24.org. So it's the word wellness, the number 2, the number 4.org. You can book appointments online too. You don't even have to call. I know these days people are really busy. They don't always have time to pick up the phone and talk. So you can request an appointment online. Pretty simple stuff. So again, Dr. Tyler Hamel, happy Tuesday. And again, if you guys have any questions, put it in the chat box below. If you learned something about the spine, straight spine, bulging disc, chiropractic, postural exercises, like the video, please share it. There's a lot of people in the Kingwood area that, they just don't know what to do, and they're living with pain, and some of them have kind of accepted that. But I think pain, is never normal. We shouldn't have to live with it. So again, Dr. Tyler Hamel, thanks for watching the video.